when patient is coming from conventional treatment, they are taking a conventional treatment and they are thinking of approaching homeopathy for their autoimmune disorders. Then how can we first, what should be our first approach for those patients who are like habitual of getting instant reliefs from the anti-inflammatory medicines, and what should be our approach in those cases?
I do believe that a lot of importance should be given to education. So generally, if the patient is at that kind of level where you can actually educate the patient, I think it's a good idea if we can educate the patients, tell them about what autoimmune diseases and how homeopathy has a kind of a potential to be. So educating and creating awareness is a very important kind of part. And the other very important part, which I also believe is that in many of these cases where the patient is taking a lot of allopathic medicines, I don't think that you can just on the first day stop all the allopathic medicines. I think they have to be tapered down gradually, and you have to take the patient in confidence and handhold the patient towards this healing process, I believe. And
Okay.
and finally, a very important part is that many times what we often do is that if a patient is taking a particular allopathic medicine for a very long time, let's say um, um, if a patient is taking prednisolone for a long time, okay, like 10 years or something, we could often in homeopathy give prednisolone in a potentized dose, you know. So this technique is called as tautopathy. This was started by another great legendary homeopath called as R.P. Patel. There is a nice book by him, which is red in color, small book, Tautopathy by R.P. Patel. So he started working on this, and now many homeopaths are using this, for example, chemotherapy, etc. So this tautopathy is something that you could often use in musculoskeletal disorders, in autoimmune disorders, in hormonal disorders. So we are using a lot of remedies like cortisone 30, adrenal cortex 30, remedies like methotrexate 30, for example, or estrogen or testosterone 30. I use it at a day-to-day practice, and quite fascinating to see results. Homeopathy is growing quite a lot, doctor. And one of my feeling that I get very often is that sometimes we are fixed. We are in a state of thuja, we are fixed. यही है. Homeopathy is only Allen's keynote. Homeopathy is only Boric. So I feel that, of course, Allen's keynote and Boric and Kent repertory, and this is all part of something that is a heritage part of homeopathy, and we have to master it. But homeopathy is much beyond only one or two books, is what I see, because when one travels, one learns a lot and one evolves a lot. Homeopathy has gone beyond just one or two books, and there is a lot to do, lot to explore at a day-to-day level. And at this moment, I'm learning and reading so many newer literatures because we can't be fixed. The disease patterns are changing. What Hahnemann spoke so many years back is true, totally true. But remember, he wrote 6 editions, 5 or 6 editions in Organon in his own timeline. Imagine if he was present now, he would have come out with the 100th edition of today's time. So one has to kind of innovate and be in today's times and evolve. And that's the reason that we are taking the education very seriously. Ours is the one of the only academies which kind of connects the old classical homeopathy to the newer approaches, and that's what we do in our online courses and in our seminars that we do.
Very soon with the online course starting from December, where me along with my colleagues across the world, including my teachers, Dr. Sarkar, Dr. Gajanan, Dr. Borkar, other colleagues in UK, in Croatia, will be joining to teach a 30-hour online course only on weekends with 25 lectures, with an access for 2 years for you to watch the videos again and again, with a WhatsApp group where you all will be joining and trying to solve cases every week, also kind of training there. And this course will be starting in December. There is a special close to 25% discount for all you people for the early bird. So the seats have already started to kind of register. We have the last few seats. I want all of you to be a part of this, and I want to study with all of you together. So you have all the details, gaurang@gmail.com, and all the contact numbers. I look forward to have you with me. Thank you, bonjour, and merci beaucoup.